It's your life, it's your heart. Smarter Heart University, your institution for higher heart learning without the confusion, where everyone can get a passing grade in life. Attend Smarter Heart University with Dr. Scott on AM 970, The Apple.
Good morning. This is your Smarter Heart University. I'm your Dr. Scott, and along with me is my usual co-host and cardiology partner in crime, Dr. Robert Kaiser. Good morning, Bob.
Good morning, Scott.
Callers, and we hope you can call in today at 866-970-9622. We would love you to call in and join us today for this wonderful topic that we have for you. Just a couple of housekeeping tips. Our website is fully integrative at this point, www.smarterheartuniversity.com. All of our Smarter Heart shows are up there, both audio and a number of them are now that you can watch from YouTube. Literally just by clicking on the all videos link from the main website. But we urge you to register, become a member, and what we want to do is make this a thriving community. We've got some groups ready. I've created a cholesterol awareness group, and one of our patients has created a heart surgery survivor group. And we're going to create some other groups. And we want people to interact with each other, and Dr. Kaiser and I will work with you to answer all of your questions. The Facebook site continues to grow. We get at least 10 new members a week. We're approaching 200. We blog every day, and we give you up-to-date information. Whether you listen to our shows, whether you sign up on the main website, you're going to hear it from us first. It's a rainy Sunday in New Jersey. It's also the start of football season. Perfect day to sit back on the couch and eat some chips and dip and eat some wings and drink some beer. And this is a perfect lead-in to today's topic. So our popular question, as we always start Smarter Heart University off, I want to start a diet. Which one is better? Now, folks, this is a loaded question. It's our common knowledge that obesity is a worldwide epidemic and problem, and it continues to get worse. And what's also clear is the medications to reduce weight have been so disappointing so far. And since pills have failed us for the most part, we've seen a recent surge in bariatric surgery, the bypasses and the lap bands. And some say the short-term benefit's pretty good, but the bottom line is the long-term studies are really needed to see if this works. And sticking with it is a big problem with this surgery. So what's left? Oh, yeah. Lifestyle modification, dare I say those two words. So many diets, which is best, so many competing ideas and theories. And regardless, the common problem, whichever you have chosen, is did it work, number one, and more importantly, did you stick with it? Because, my friends, the biggest challenge is our behavior has failed us. The ability to stick with a lifestyle change for your lifelong benefit. I couldn't say it any better. Now, in 2008, there was a major comparison study of some of the more popular ways to diet. All three diets, major ones, showed a weight reduction. The quickest was with a low-carbohydrate diet. All improved the parameters of blood pressure and cholesterol. But over time, 50% of the patients gained their weight back, so that the overall weight loss was very, very mild, about 6 to 10 pounds. It's a big take-home point with any diet. So despite the fact that Atkins and Zone and Sugar Busters and South Beach have proven beyond a shadow of a doubt that they can lose weight and they won't harm you, and we'll say that again a couple times, they have little evidence of life benefit. Conversely, the Mediterranean approach has long proven cardiovascular benefits. And in 2006, folks, the American Heart Association wished upon us the desire to integrate all of these diets into one stepwise integrative approach and an individualized approach as well. But let's face facts, and this is important. Poor changes in our lifestyle are considered the most important role in our developing diabetes and obesity. Now, 40 years ago, it was recommended that we should decrease our fat and we should increase our carbohydrates. So has anything really, really changed? It's been stated that restricting your calories is more important than what type of food that you eat in terms of losing weight and controlling your weight loss. But lately, the composition of your diet, such as decreasing your carbs or increasing your unsaturated fats or proteins may improve your cardiovascular factors, such as your blood pressure and your blood sugar control, independent of any of the weight loss. And that's an important point. The problem is this really hasn't been endorsed by any of the major organizations at this point. Now, if you learn anything from us today, it's this. It's important that any diet, whatever type it is, should improve your disease endpoints, not just your risk factors like the blood pressure and cholesterol. And I cite Dr. Dean Ornish, one of my favorite heroes in preventative cardiology, because this is his whole concept. So what is that, if you might ask? It is not enough to lose weight or lower your cholesterol, sugar, and blood pressure. Does the specific approach end with less heart disease, less death, and less cancer? Because that's what we're driving for, right? So if we're going to attempt to look at diets, we need to break them down in the following. Number one, the diet and their cardiovascular risk, high protein versus high fat, or low fat versus low carbohydrate. But we also need to break down a couple of myths first before we start about your eating. Number one, eating late at night causes weight gain. Nope. The time of day is not really important as much as what is eaten and how much over that day. We always tell our patients, you need to understand that it's the total amount of carbs, the total amount of fat, and the total amount of the type of protein intake each and every day that determines your weight and your cholesterol, your blood sugar, and your blood pressure. Number two, carbs are fattening and should be limited if you want to lose weight. Incorrect. This brings up what we at Change of Heart Cardiology call bad labeling. There are healthy carbs and unhealthy ones. And examples of the healthy ones are vegetables and fruits and whole grains. And the big difference is the simple refined sugars such as white bread and white rice and pasta. Number three, skipping meals is a good way to lose weight. I do not think so. This is not a very effective strategy, and people have been found to be much heavier when they skip meals, especially breakfast, or eat infrequently. Number four, all fats are bad. By now, everyone knows that this is absolutely wrong. Saturated fats like red meat and whole dairy products can cause heart disease, and unsaturated ones that are rich in olive oil and nuts and fish can reduce it. And lastly, people with diabetes must avoid sugar. Maybe in the past, but not now. Newer research shows that sugar doesn't raise your blood glucose any faster than the common starches that I just said, like the bread and the pasta and the rice and potatoes. And the main focus should be limiting your saturated fats with diabetes, then reducing, not cutting out your sugary foods. So what, Dr. Kaiser, what do you think about my initial opening statements?
It's a lot of revealing information there that I don't think we really put in all to one synthesized statement like you just did. From my standpoint, when I talk with my patients, like you said, we're talking about, if you will, two different things. One is, do you want to lose weight? And what do you need to do to lose the weight? And then the other thing is the endpoint. Why do you want to lose weight? Do you want to lose weight because you want to look different, or do you want to lose weight because you don't want to die of a heart attack? And so there's kind of maybe two different goals there. Sure, if you don't eat, you don't take in calories. I mean, you look at the folks in poor, impoverished countries who can't eat, who don't eat that much. Yeah, you're not taking in that much calories. But is it going to change your heart, whether or not you're going to have an event of a heart attack or something like that? And that gets as much to the quality of the food you're eating as much as the quantity of food you're eating.
And we're certainly going to touch upon that today. But you bring up the point, and we talked about the longevity genes and feast or famine in impoverished places where they don't eat, and yet we survive. And we don't necessarily have heart disease. We have other illnesses that they get in impoverished areas where we need to get food to. But the bottom line is that you hit the nail on the head. Do you want to lose weight to get to a high school reunion? Or do you want to lose weight so you can live longer, live healthier? We're going to do an anti-aging show. It's called Live to 80 and Feel Like 50. I mean, because it's not enough to live to a nice ripe old age. How do you feel? What we call comorbidities? I mean, what happens along the way? Do you get cancer? Do you get vascular disease? You know, we talk about heart disease, but do you get vascular disease? Do you get other ailments, autoimmune diseases? You know, we in the integrative medicine field look at this, and we're going to talk about that near the end. So, you bring the point up.
And this also has to be a permanent change for life. I mean,
Yes,
this is not. I think it's well established now that you decide, okay, I need to lose 10 pounds or I need to lose 20 pounds. I go on this diet, and yeah, you'll lose the weight because you've changed the way you eat. But then all of a sudden you go right back to the way you used to eat, and you put the weight right back on. We're talking for life, the rest of your life.
Absolutely. So let's take a pop quiz going into the next segment. I'm going to have Dr. Bob take this one. Which diet helps you lose more weight? A carbohydrate-rich diet, a protein-rich diet, or an unsaturated fat-rich diet? What do you think?
I'll go with the unsaturated fat-rich diet.
Okay, we'll be right back on Smarter Heart University on the Apple AM 970.